and from object to object. And this is how objects are related to each other with reference. So then obviously what body does it to maintain the upright posture, and then it's obviously we need stabilized eyes to maintain our balance. The vestibular arrangements are basically they are mechanoreceptors. They respond to motion or they respond to movements. So nature has put them in specific planes. So they are right angle to each other, and technically it is known as, it is going to contain a structure inside which we will talk about. Then we have got the other structure which is saccule and utricle. Here we have got another unique feature, that is the presence of otocorneal membrane. So semicircular canal, we have two types of, we can classify, either we are dealing with the angular acceleration or we are dealing with the linear acceleration. So when we talk about angular acceleration, we are talking about the semicircular canal. So we will talk about shortly what is crista and what is the crista ampullaris. So if we look at the ampulated end, the canal is coming like this and it ends as an dilatation, and this is known as an dilated part of the semicircular canal or the ampulla. So inside the ampulla it is having this structure, which is a gelatinous structure which contains polysaccharides and mucopolysaccharides and protein meshwork. So it is whole this structure. Then below that we have got the hair cells along with the supporting cells, and then finally the nerve filaments are emerging out of it. So this structure plus this put together we call it crista ampullaris. So what it does is the movement which will move it. So this is how when we are static, and this is how when we move. We will see shortly some animations, and we will talk about it. As I said, this is for postgrads and keen learners. So just something which you can apply on your patients. So this is known as rule of hand. As I said, it is right angle to each other. So this is, they are put in certain axes. So every canal is assigned with a specific movement. So if you're looking at a patient who is sitting in front of you with his or her left ear in front of you, so you don't need to imagine that how canals are there. So you can see